अप्रैल 2022 का पेपर सॉल्यूशन करेंगे आज हम। ठीक है, 5 क्वेश्चन करने हैं। 80 मिनट 80 मार्क्स का होता है, 3 घंटे का होता है। ठीक है ना। पहला क्वेश्चन है, डिफाइन होम विजिट, राइट प्रिंसिपल्स ऑफ होम विजिट और डिस्क्राइब बैक टेक्निक्स एंड राइट द इम्पोर्टेंट इन कम्युनिटी। ठीक है, तो पहले बोल रहा है कि जो होम विजिट है वो 103 पेज पे है। तो 103 पेज का है अपने पास, ये रहा 103 पेज। हाँ, ये रहा 103 पेज। तो ये रहा क्वेश्चन, डिफाइन होम विजिट, डिस्क्राइब एवीजी टेक्निक्स इन डिटेल, व्हाट आर द रिस्पॉन्सिबिलिटी ऑफ द कम्युनिटी हेल्थ नर्स ड्यूरिंग द होम विजिट। तो मीनिंग ऑफ द होम विजिट, होम विजिट का मतलब क्या होता है? ए विजिट टू ए पर्सन होम स्पेशली बाय ए हेल्थ केयर प्रोफेशनल और सोशल वर्कर। जो ये होता है ना, स्पेशलिस्ट होना चाहिए, हेल्थ वर्कर, प्रोफेशनल होना चाहिए, सोशल वर्कर होना चाहिए। फिर डेफिनेशन क्या होती है होम विजिट की? द होम विजिट इज़ ए फैमिली नर्स होती है। कॉन्टेक्ट विच अलाउ द हेल्थ वर्कर टू असिस्ट द होम, जो कि असिस्ट करने जाती है घर पे। एंड फैमिली सिचुएशन, जो भी फैमिली सिचुएशन है वो देखती है इन ऑर्डर टू प्रोवाइड द नेसेसरी नर्सिंग केयर, और जो भी नेसेसरी केयर होती है वो प्रोवाइड करती है। एंड हेल्थ रिलेटेड एक्टिविटीज़, और जो भी हेल्थ रिलेटेड एक्टिविटीज़ होती है वो उनको बताती है। होम विजिट इज़ ए विजिट बाय ए डॉक्टर और नर्स टू a patient in their home. This kind of visit are among the monitoring process of a patient, and there are usually a home visit is defined as the process of providing the nursing care to patient at their doorstep. It require techniques, skills, resourcefulness, judgment, relationship, BAC techniques. डेफिनेशन, द बैग, अब देखो BAC टेक्निक्स में क्या होता है? द बैग टेक्निक्स इज़ ए टूल बाय विच द नर्स परफॉर्म ए नर्सिंग प्रोसीजर विथ ईजी एंड डिफनेस ड्यूरिंग द होम विजिट। इट सेव टाइम, एनर्जी ऑफ नर्स एंड हेल्प इन rendering effective nursing care to patient. A public health bag is essential and indispensable equipment of health nurse. Step is performing bag techniques. Step, upon arrival at the patient's home, place the bag on the table inlaid with a clean paper. The clean side must be out and further part touching the table to protect the bag from getting contamination. Ask for a basin of water or a glass or drink water if tap water is not available, to be used for hand washing. One the bag and taken out towel and soap to prepare for hand washing. Wash hand using soap and water will to dry to prevent infection for nurse to patient. Take out apron for bag and put it on with the right side to protect the nurse uniform. Put out all the necessary articles needed for special care to have them readily available. Close the bag and put it one corner of working area to prevent contamination. Perform the necessary nursing treatment to provide comfortable and फिर क्या है? आफ्टर ट्रीटमेंट क्लीन ऑल थिंकिंग एंड वेयर यूज एंड परफॉर्म हैंड वॉशिंग फिट टू प्रोटेक्ट द केयर गिवर एंड प्रिवेंट इन्फेक्शन. रिमूव एप्रन फोल्डिंग इट अवे फ्रॉम द person the salt side and clean side out. Place it the bag to follow medication absent practicals to full the leaning. Place it inside bag and close the bag. Take the record and write down all the necessary data collected by observation, nursing care and treatment giving for reference in the next visit. Make appropriate for the next visit. Follow up care. Principles of bag techniques. It should minimize prevention of any infection. It save time and effect in the performance of nursing procedure. It can perform in a variety of way depend upon home with situation. It can be the bag should be keep in clean area without danger of being contamination by children or domestic animals. The bag should be covered properly when do not use point to consider white using the bag area. ये सब कुछ प्रिंसिपल्स है. द बैग शुड contain all the necessary articles, supply and equipment that will be used in emergency need. The bag and it contents should be cleaned and replaced very often and should be ready for use anytime. The bag and its contents should be will protect from contact with any articles in the patient home because bag and its articles consist sterile. The arrangement of the bag consent should be convenient for the use. It must facilitate effective and avoid confusion. Responsibility of community health nurse during home visit. The especially responsibility of the home visit nurse varies from job to job, but some general responsibility are making IPR, stabilize IPR with the family. Assessment. Patient assessment is one of the first responsibility of community health nursing during home visit. Patient recovery care during home visit are do not serious as admit in hospital. Not so serious as hospital admit in hospital. It important for the nurse assess all the body system of the patient, effectiveness of intravenous physical environment, identification of protectional hazard, treatment track are the main response for the home visit. It may be administration IV route, changing dressing, monitoring, maintaining ventilation system, assessment of full other treatment intervention. A home visit nurse autonomous private provide contamination medical supervision as per policy and procedure. Providing health education. Patient technique is very important part of the home visit. Is nurse should make sure that the patient and family understand and treatment. फिर क्या है, why where are getting the treatment, what type of the result, why should accept. Nurse can make referral for the family as needed. Care coordination. A community health nurse is responsibility of coordinating communication with other health care professionals. She communicator with patient, primary care provider, social worker, family therapist and other personnel who are involved in the care. अब हमारा फर्स्ट का ए कंप्लीट हो गया. इतना सारा लिखना है 2 नंबर में नहीं, सिर्फ डेफिनेशन ही निकली. ये सब मैंने इसीलिए बताया है ताकि बड़ा क्वेश्चन पूछे तो भी हम लिख सकते हैं. प्रिंसिपल ऑफ होम विजिट. प्रिंसिपल्स क्या है होम विजिट के? फॉलोइंग प्रिंसिपल आर द इम्प्लीमेंट ड्यूरिंग होम विजिट. नीड बेसिस. होम विजिटिंग शुड बी प्लान्ड ऑन द बेसिस ऑफ कम्युनिटी पीपल. नीड शुड बी प्लान होनी चाहिए. नीड बेसिस, प्लान बेसिस. it be part of the planned visit program. Respect the person and feeling and need it the time of the visit. Collect background information regarding the family in particular and community in general. That information regarding the family size, occupational income, religion, resources, custom and culture. Identify the health problem of the family. Techniques best. Use safe technique, skills and nursing procedure. Scientific best. In health techniques, be sure of what you discuss. Scientific soundness. Flexibility. The nurse should adopt a flexibility approach based on preventing circumstances in home. Regu- Regulatory. It should be consent in regulatory interventions. IPR. Intrapersonal relationship. Best maintain good IPR with family and plan care for joint. The appear to family should be kind and consent with the view to gain their confidence. Working knowledge of community resources is very much essential. Quality is more important than quantity. फिर क्या एनालिसिस बेसिस इवैल्यूएशन इन essential factor in other daily work. Record the work performed by community health nurse in each visit. Fits equation a back techniques and it important in community. Important of back techniques in community. It is initially drug each visit school and individual visit to the some nursing procedure. The community bag act as a vector from carrying the tool during home visit. The community bag help to demonstrated some nursing procedure during home visit. The community bag are kept ready for use so that there can be used at any time for providing nursing care. Supply and equipment. Bag with removable plastic and cotton lining outside pocket contain recourse soap in plastic bag, plastic box sorry plastic box or bottles. Newspaper sequence न्यूज़पेपर्स मटेरियल्स बैग में रखनी चाहिए. इनसाइड द बैग कॉटन प्लास्टिक बैग ड्रेन विथ कॉटन शॉप प्लास्टिक ड्रेन ये सब कुछ रहना चाहिए. इंस्ट्रूमेंट क्या होनी चाहिए? आर्टरी फोर्सेप ड्रेसिंग फोर्सेप सीजर 5 आई ड्रॉप सॉल्यूशन और ओरल थर्मोमीटर रेक्टल थर्मोमीटर ब्लड प्रेशर इंस्ट्रूमेंट स्टेप्टोस्कोप फोटोस्कोप मसल स्कर क्लैड कॉप टिथ non-teeth forceps needle holder solution and drugs plastic bottles containing surgical speed plastic bottle or Dettol eye ointment other medication is applied in standing institution. और बाकी हम 103 पे और देख लेंगे. 103 पे हमने जो अभी पढ़ा था ना वही है प्रिंसिपल्स ऑफ बैक टेक्निक्स वाला ही.